Good morning, everyone. Thank you, arigato gozaimasu, to you for inviting me and to coming here today. So firstly, although this is labeled as a tropical section, what we're dealing with foot and mouth disease, in fact, is a disease that knows no limits and no boundaries and rather enjoys a temperate, cool climate such as the climate we have today. I think you all know it's a multi-species problem affecting really all cloven-hoofed animals, including pigs. But this is the amount that most people know. But do they really understand and take on board the risks associated with this infection? Now, a few months ago, in one of the courses that we were organizing, which gives people exposure, gives them experience of foot and mouth disease in the field, we had just seen some of the worst cases of foot and mouth disease in Kenya in our experience. We were on a farm, and on walk, two dairy technicians from the Netherlands in their normal sort of sneakers, who were there to inspect the newly installed robotic parlor. And they were going on afterwards, same day, to 3 other farms, 2 the next day, and then returning to the Netherlands. Now, I have no words to describe this lack of understanding of biosecurity, but it's a threat. It's a risk in our modern world that people don't understand, that this is a very common disease, and it's very easy to transmit. So, what is foot and mouth disease? Well, it's a very tiny virus which is extremely transmissible and quite enjoys most environmental conditions. It's moderately stable, which means that it doesn't disappear immediately. It can be carried on people as well as fomites. What does it do at global level? Well, it's been estimated that around 2% of the world's cattle population develops foot and mouth disease every year. That might surprise you. And based on clinical cases, the estimates a few years ago were 32 million cases a year. But when we subsequently look more at the serology, it's probably quite a lot higher. It may be something like 250 million cases a year. So it's frequent and it's a big problem. Globally, FAO Stat estimates around 1.7 billion large ruminants. About 1 billion of those are in countries which are not free of FMD. So the countries in grey are not officially free of FMD. The countries in green are ones which have achieved a status of being free of FMD according to the OIE standards. So a big part of sub-Saharan Africa, Middle East, and Asia is endemic for FMD. Estimates of the level of losses, annualized losses, indicate that around 1.5 billion is lost in free countries in terms of incursions, but something like $11 billion is lost annually in not free countries, and that equates to around $12 per head of large animal in those endemic countries, 6 times higher than we lose in free countries. That might surprise you because a lot of people's perception is that this is a disease of trade. It's a disease which is one that we fear, but is not really a real disease in tropical countries. This is not the case. So our great challenges for control are this extraordinary level of contagiousness and the difficulties with vaccination. The other alternatives, which rely on animal movement control, biosecurity, often there's a lack of ownership to be able to really take on board the very difficult tasks in endemic countries to control those parts. And we could say the public and private can do a lot better in terms of working together. So whose problem is FMD? Well, traditionally we thought of this as being a public good problem, a problem in which government must act because it involves so many stakeholders, so many farmers. But in endemic countries, we see the problem really being shifted onto herd owners. It's their problem to deal with because government doesn't have it perhaps as a priority. So that's one of our big difficulties, is trying to make a better compact between public and private agencies in endemic settings. It's also a problem in free countries where there is always a debate about how much the industry needs to do and contribute to compensation. So in my presentation today, I want to say a little bit more about why FMD matters, why it's also a herd health problem, globally, what progress have we made, and then what we can do better working together. So, again, why it matters? Well, it matters for a number of reasons, but a lot of the difficulties relate to the fact that it's so easy to transmit by animals, by fomites, and then indirectly by consumption. So there's an explosive spread, and that's a large reason why it's feared in free countries. But in terms of tropical, as the title goes for this session, tropical or let's say non-free countries, it's got a reputation that it's not a big killer. Well, it makes up for that by being extraordinarily successful at infecting animals. And seropositivity rates in a range of studies indicate that something between 30 and 50% of large ruminants have antibodies to foot and mouth disease, which equates to something like 30% exposure per year. Small ruminants, several of the studies indicate slightly less, but still high levels of exposure. So a few years ago, we tried to estimate the global burden of disease based on a number of indicators, and we came up with charts that looked like this. If you're coming from South America, please do not be disturbed by this. These were based on data from about 15 years ago. And there you can see that in a band across sub-Saharan Africa, through the Middle East, through India, through into China, there are high-level indicators for FMD. When we matched that with genotyping, we tended to see that there were ecosystems would emerge. And these ecosystems are essentially separate lineages of FMD virus which circulate within those ecozones. And this gave us a basis for developing a kind of regional approach to FMD. So since the last 10 years or so, we focused on a regional approach based on that ecosystem maps. Okay. So briefly, for those of you who do come from free countries, we have not forgotten you. We've not forgotten you in our work. There is a very severe impact remembered in many countries and continues to be a fear of FMD associated with the efforts to become free again after infection. So those are really still severe risks and taken very seriously. But what I'm trying to emphasize in this is that this is a real disease within endemic countries because of the high level of exposure. And although the clinical signs may be less severe than in a naive population, of course, there is a cyclicity of infection, which means that one wave of epidemics follows another. Okay, various estimates for visible losses. I don't think we have time to go in through now, but there are quite a number of things for herd health practitioners to keep in mind. Growth rate suppression of young stock, the results of abortion, as well as the effects on milk production, which we can talk about. The invisible losses are ones that people don't perhaps talk about enough, and those are the compound effect of FMD upon fertility, which I think is something that one of our chairmen, one of his interests is in this area. So a year or more after FMD, you can still have a severe effect on the replacement or breeding stock. There's also the cost of control measures. Globally, it was estimated a few years ago that around 2.4 billion doses of FMD vaccine are administered around the world. And that cost is not only falling on the state, it also falls very much on the private sector. Do not forget the cost of treatment. The cost of treatment might be 100 times the cost of vaccines. And we do see internationally that it's quite good business for animal health providers to be providing treatment after FMD. At vaccine, you don't get much money for vaccinating. Supplying antibiotics and treatments for several months, you make a lot more money. So how do we get prevention more than treatment? And I've mentioned the staggering level of numbers. Okay. Just at the more personalized household level, this equates to something like around half the herds in Cameroon experiencing FMD every year, and over 80% of agropastoralists experiencing FMD every year in a country like Tanzania. Because it comes in waves, one epidemic of one serotype can be followed by another. So the epidemics tend to be following in something like between 6 months and a year between them. So this is common. Okay. When we equate that to the impact on households, then in Cambodia it was estimated that around 12% of annual income of the poorest can be lost as a result of the FMD cases. And in Ethiopia, again a country which has a high level of FMD, cases of FMD at household level result in a 7% annual income reduction. So it's big at the household level as well. So in summary for this section, there's a much higher economic loss in endemic countries than there is annually in free countries, but that cost largely falls upon the poor producer. Okay. What about the herd health side of our problem? This is an area where I think a lot of you could get into and do something very good. There are really not enough studies in this area. But just some of those ones, I'll just pick out some data from Kenya from one of my co-authors. Looking at individual herds, an outbreak on a dairy herd might last around 30 days on one case, or over 3 months on another case, dragging on. The mean daily milk production per cow declined to around 50% and did not recover in a 7-month period. That might be survivable if it happens once every 5 years, but not if this happens every year. Submission rates, there was a severe decline for 2 months after FMD cases, although the immediate effect on fertility was not so great, but that submission rate had impacts a year later. Culling rates, these two lines are probably difficult to explain them, but basically there was a significant rate of culling of FMD cases compared to non-cases over a 12-month period. And those take a while to manifest as farmers try to treat their animals and then find that's not successful. And there's a 3 times higher hazard of mastitis in the first month after FMD, with a significant treatment cost. We also found in these studies that from the third parity onwards, there was an increasing severity of impact, which is maybe not what you always expect. So what can herd health practitioners do? Well, I think adopt some of the good things that are done in other regions and apply them to the question of biosecurity for dairy farms trying to operate in such an environment. And of course, there's a range of things to do on that. You need to develop a risk-based plan for the herd, and to guide standard practices, standard procedures when there's suspicions of cases, including containment of cases to stop them spreading within the farm. So many of those things are being done. I can hear from other talks here for dealing with BVD and from IBR and other cases. FMD is something where, although it's difficult, we do see a significant assistance by early detection at farm level. So it means training people to know what to do as soon as they suspect signs. Biosecurity at herd level. We see, of course, huge range of different types of herd, and these are two of more organized ones. One of them is in the Middle East, the other one is in Kenya. Sometimes an emphasis on entry-level precautions, but of course people working there have got to keep it in mind at all times. The measures like foot baths and vehicle washes can be really overcome by workers coming directly from their own holdings, for example. So there's lots of ways that FMD can enter, but a practitioner should be able to look at those things. High-risk situations include beef feedlots, where there may be not an all-in, all-out, but there might be purchase at markets. There needs to be entry quarantines and vaccination. Herds with significant on and off movements. In an endemic country, these are high risk. And when farms are surrounded by communal grazing or by neighbors whose animals are pretty much coming up to the fence, then things like sheep wandering from one farm to another can be the bigger source of risk when everything else is controlled. Again, practitioners, you should be able to look at that and give advice. Optimizing vaccination programs at herd level. Now, I think this is an area where we need to get a lot more practitioners looking at. We're always being asked this question: how frequently should I vaccinate? Do I need to increase the dosage? At what age can I vaccinate calves? And these things very much depend on the vaccine. They depend on the risk. They depend on let's say, the prior history of those animals. There again, you need to have some science behind it, not just manufacturers' recommendations, and their practitioners should be able to make a difference to develop good immunity, particularly in the 6 to 18-month age. So increasingly, we're beginning to look at and encouraged to look at similar things that are used in other areas of herd health. What about herd testing for immunity? What about using bulk milk as a way of testing for immunity? It may be crude, but if all animals are vaccinated, then the bulk milk should represent a sample from the lactating cows. Why not use that? It could be interesting and low cost. And that can also be potentially useful for surveillance, because in many countries, pooling, of course, takes place as milk is pooled through cooperatives. That's a cheap way of getting a sample. Maybe half the cows in a country can be sampled simply by bulk milk. And so we're looking at that as a means. But definitely you need to have herd-level contingency plans, what to do in the case. Too many places try to hide it. They really don't want to tell anyone about FMD when it happens, but at least they should have a plan, what they're going to do to try to minimize the impact. And early detection is something that is possible, not just clinically, but also in terms of pen-side tests, which are available to test both for FMD, but also these days also for serotypes. Okay, so what are we doing globally? My organization is part of the umbrella, comes under the umbrella of FAO, the Food and Agriculture Organization of the UN. And we work very closely with also the OIE, the World Organization for Animal Health. So around 10 years ago, this year, we started something as an approach to help countries to develop their national strategies. And that was called the Progressive Control Pathway approach. And I'm happy to say that this approach of stepwise, risk-based, improved management has been taken up and used also for other diseases. The global PPR campaign is based on exactly the same template. We have progressive control pathways for trypanosomiasis, stepwise approaches for rabies. So this was really the forerunner of what we might call the progressive movement for disease control. And this basically has a series of building blocks for management, here focusing at national level. And the first stage is simply to make a plan based on a good understanding of the national risks, the national benefits and the stakeholders and their interests. Make a national plan based on co-management between industry and the public sector. So stage one is to develop a risk-based strategic plan for the country. Stage two is to implement that plan, trying to control disease in at least one sector. Stages 3 and upwards are about population control, which I won't go into. But now we've got a second iteration of this. This pathway leads now seamlessly through into the OIE recognition process. So by building up your competence at national level, you get to the point where you can apply for recognition of a country's official control program. So this pathway was taken up in developing a global strategy between FAO and OIE that was adopted in 2012 with 3 components. One was to focus very much on FMD as an issue, but in parallel to ensure there is a strengthening of veterinary services, and thirdly, that by focusing on a risk-based approach, you can also make it an entry point for other diseases such as, for example, PPR or contagious bovine pleuropneumonia. So between FAO and OIE, they agreed on what would be the structure with a global working group. So there's a global side with global networks. There's a regional side focusing on these ecosystems, which developed roadmaps for each of those ecosystems I mentioned, promoting regional laboratory and epidemiology networks, promoting regional proficiency of laboratories within that area, and also focusing on common issues such as cross-border and what vaccine works in a region. National level is really the motor for change, and so a lot of the work, including the work of my team, is to help countries to develop a national strategy which will get them started or then to monitor progress. So we have, since 2012, had something like 19 of these regional meetings, regional roadmaps, to develop a longer-term plan across the region based on what countries aspire and say they will do using the pathway. Okay. And although the progress is, in some respects, relatively slower than of course, was aimed in 2012, there has been a change, and we've used a color system here. You'll have to look for changes between 2012 and 17, and there have been a number of countries that have moved from stage 0 into stage 1, or stage 1, developing a plan, into implementing the plan. But the large bulk of our infected area is still the same. And a lot of that problem goes down to the fact that it's very hard for countries to make sustainable plans if their budgetary situation does not allow them to make long-term plans. And in part, that relates to a notion that FMD control is really a public good and it must be controlled by public servants, which is something that we may in the past have encouraged as FAO and OIE, saying FMD is a global public good, we must control it, but negating the fact that private individuals are affected every day and have an interest in control, and we're not doing enough to encourage them. So there are issues when I preach this idea that we should be focusing on services, availability of vaccines and advice to herd owners in endemic countries. There are some deficiencies. We know that disease can be controlled at herd level with a good vaccine. However, the supply problem comes in. How do you access a good vaccine in a country where perhaps the public policy is that the vaccine should be delivered only by state veterinary officers? That can be a real difficulty, and that's where I think veterinarians together with the industry need to probably provoke more discussion at country level. So public-private partnerships, the development of the market for good vaccines is inhibited sometimes by public attitudes instead of making it available. There's a few countries in the world where you can pretty much get any vaccine you like, and there are countries such as Afghanistan. You know, that's a good example where you can essentially get vaccines for a variety of sources, and farmers will tell you this vaccine works and that one doesn't work. But in too many countries, there is no choice, and that's difficult. So what can we do about this working together? Well, firstly, we have set up structures to try to work together, global level between FAO and OIE, as a working group on this. I've mentioned the work with regional communities and economic communities to try to develop longer-term roadmaps, and the national motor, which is where things really have to happen. That's something where we try to work with them and give them support to develop national plans. However, within those national plans, that's where I think a lot of change is needed and where we need to work better. So public services may be in denial. They might say, well, FMD is not a priority. Well, it may not be a priority to a government dealing with maybe public health issues. But that doesn't mean it's not a priority for producers. So producers on the private sector, how are they going to get their voice heard? Veterinarians, private practitioners, industries could probably do better to try to get engaged in those discussions. So the livestock industry, I think, has a great opportunity to drive change, but its voice, of course, needs to be heard. So we tried to encourage those who are working as practitioners at national level or at herd health level to get into some of these topics, and they're maybe a bit specific to FMD, but they're often very much national ones about developing a national strategy. We've developed some networks whereby those who are interested can meet online and get tutorials and seminars, and we've developed a whole e-learning program in multiple languages to help in this. For those of you who have not seen FMD in the field, and to wake you up, maybe I can just ask you to raise your hand. If you have never seen a clinical case of foot and mouth disease, can you put your hand up?
Wow. Wow.
Okay, for one of the world's most common diseases, it's kind of telling. Maybe we've been too good at keeping it out of free countries. But we've developed a few years ago a face-to-face training whereby veterinarians can see clinical cases, and so they can develop and use resources to teach the people that they're working with about FMD control. So over 700 vets have been trained in over 60 courses from Europe, from Australia and New Zealand. This has been a real big motor for talking about FMD in free countries, as well as a good partnership. In terms of developing national strategy, if those of you who are working with tropical countries, non-free countries, we do offer some more in-depth courses on how you start to get involved, how you start to make a national strategy. And if you can't travel to any of the things that we do, then this online training is now available in multiple languages, including Arabic and Russian. I'm sorry, no Japanese at the moment, but that maybe some of the universities here can help us with that. Okay. So there's a range of things that we try and do: open access, networks, and tutored online training. So we found that e-learning is a powerful tool. And perhaps the most recent innovation is people telling us that they cannot access internet when they are not at work. And at work, they cannot access it because their boss is looking. So we said, okay, let's try and do something using WhatsApp. So now for West Africa, we've developed a training program in which nearly everything is downloadable through WhatsApp. And it's amazing. So we have people now exchanging information. I am seeing FMD. What should I do? What sample should I take? So we didn't expect some of those things to happen, but they happened because people said that's how we want to learn. Okay, so how to get involved if you're interested in more. If you're a practitioner here with lots of experience in making herd health plans, we need a lot more of your kind of examples in countries which are faced with dealing with FMD risks to dairy. We need to better integrate as practitioners between vaccination, biosecurity, and response plans, not forgetting the amount of antibiotics being used. And maybe if you haven't got the experience face-to-face, find a way to get trained on that. Unfortunately, we have to charge when we take people. We can't just take them for free. If you're involved in a veterinary chamber, then I think there are some issues in terms of the question marks over how to get prevention, much more than treatment, to be the norm, and how you might work on the barriers to that. Vaccine supply, that's my next thing to talk about here. We really have to address the lack of supply of quality vaccines in the world because it's driving people to use bad vaccines, to have a bad experience, and then to be put off as an owner from vaccination. Veterinary educators, we need you to somehow produce more continuing professional development for graduates. You know, half an hour training for undergraduates, you know, that isn't enough. But in endemic countries, there's next to no CPD for public servants, and we need to do something about that. So on the debate about vaccine security, we are trying to bring together vaccine producers, investors, licensors, users, to have a debate on what can we do to get what can we do to improve supply of vaccines. You know, they are just unavailable in many endemic countries for a lot of different reasons that I've mentioned. So that's happening in the end of October. So in conclusion, as I know I'm 2 minutes over time, there is a massive burden on global livestock production placed by FMD. It is exceptionally challenging. It really brings and integrates so much of our training and so many of the difficulties in one disease. Global progress remains slow, except where there are good examples of public-private partnership working at country level. You can do something at herd level, even without national programs, but you need good practitioners, and as well as responsive owners. Governments as well, to make it work, need to liberalize access to effective vaccines. Why do we treat vaccines as being unsafe, whereas we see antibiotics flooding the market? So vaccine supply is a limitation. That's why we're talking about vaccine security as an issue. And in many ways, FMD is a new herd health issue. For some reason, we never thought of it as a herd health issue. We thought of it as a national issue. But it's really a herd health issue, so we need you to be involved in that. Thank you.